someone who's had a post-ACL reconstruction, we know that we've got a relatively long timeline to rehabilitate that individual. Their stress tolerance is going to be severely limited. Even if they're, say, a 28-year-old elite athlete in the prime of their career, there's going to be limitations.
Yeah, because you're at that point, you're looking for graft maturation to occur, and so that requires time. And so what you're doing is you're sequencing when you're going to expose them to greater levels of biomechanical stress to their knee and particularly the ACL graft.
Yes, that
makes sense, and that's obvious in that setting. But there are other ways of exposing people to stress in terms of how you structure that program. Do you want to explain what a more complex approach, or people talk about vertical integration?
Yeah, well, I was actually, just before we even go to that, I think it's useful to think about for the untrained or individual with low stress tolerance. It makes a lot of sense about the importance of concentrating a particular type of stressor at a cellular level. Because we know that at a cellular level, if we're, say, doing heavy resistance training, or even just, say, implementing resistance training whilst doing a lot of, say, aerobic conditioning, there can be competing interests, so to speak.
The interference effect.
Correct, at a cellular level, where the cellular pathways are essentially doing the opposite in terms of what's occurring.
The mTOR pathway versus the AMPK pathway.
Exactly. So this actually makes a lot of sense at a cellular level, let alone thinking at the actual structural level of building up, say, the cross-sectional area necessary, changes in the connective tissue network, and the actual structure of the tissue to be able to tolerate higher amounts of
So an example of this would be, as Jack's mentioning, so that people can understand in a say, sporting context or even in a rehabilitation context. If you have an athlete who's coming post-ACL and you're trying to really build up, say, quadriceps muscle bulk and strength, you may not necessarily put them through a significant amount of endurance or aerobic training at a similar time period, or for instance, within the structure of that session, like back-to-back, because what you're doing is creating a competing cellular mechanism.
Yes.
And so, for instance, if you were to do a lot of strength training and then put them on the bike for 2 hours to continue to build on their aerobic conditioning, you're potentially blunting the capability of building muscle tissue. And for that reason, you may want to then, as I said, concentrate and sequence, okay, we need to prioritize the development of muscle strength and muscle cross-sectional area, rather than trying to work on aerobic conditioning at the exact same time.
Yes.
Now, there are tricks around that, which is, from a very simplistic point of view, is separating those stimuli within the day, or separating them from day to day, when those pathways have potentially gone back to the basic level of function that they normally would undertake during homeostatic or homeodynamic for you, Jack.
I've got your trick changed.
Position, but it's interesting that you would potentially look to remove a competing stimulus.
Yes, and without a doubt, context is everything here, and we'll probably get to some of the caveats a little bit later, depending on, we need to think about the timeline in which you've got access to that athlete, in addition to identifying the needs analysis too, because it's much easier, or it's much more easy to identify, say, the requirements of, say, a 100-meter sprinter versus, say, a soccer player, where the physical demands and the metabolic demands are a lot more varied and complex.